Welcome to my channel Medicine Guide. Thank you for watching my channel. Please subscribe to my channel Medicine Guide. What are angiotensin receptors blockers? Angiotensin receptors blockers ARBs, also known as angiotensin II receptor antagonist. They are used to treat high blood pressure and heart failure. They are also used for chronic kidney disease and prescribed following a heart attack. Angiotensin II receptor blockers ARBs decrease the effect of angiotensin. This protein causes blood vessels to become too narrow, leading to high blood pressure. ARBs also treat heart failure and kidney disease and lower the risk of heart attacks and strokes. The medicine relaxes blood vessels so blood flows more freely. What is angiotensin II? Angiotensin II is a protein. Your liver produces angiotensin, one type of this protein. Enzymes made by your kidneys break down this protein into angiotensin I, and your blood carries angiotensin I through the kidneys and lungs. In the lungs, enzymes convert the protein into angiotensin II. Now we see what does angiotensin II do. Everyone makes angiotensin II. It plays an important role in body functions, but some people produce too much of this protein due to heart disease, genetics, or other issues. If there is an excess of this protein angiotensin II in the body, it can affect the number one, circulatory system by narrowing the constricting blood vessels and raising blood pressure. Number two, endocrine system by stimulating the adrenal glands to make aldosterone, and this hormone causes the body to retain sodium. Too much can lead to fluid retention, edema. Aldosterone also helps get rid of potassium. Nervous system by bringing on thirst and salt cravings. Taking in too much salt can cause fluid retention and affecting the urinary system as well by causing the kidneys to reabsorb water, which raises blood volume and blood pressure. So now we see that what angiotensin II receptor blockers treat any disease. Healthcare providers prescribe ARBs or angiotensin receptor blockers for number one, high blood pressure, that is hypertension, to lower the amount of force on the blood vessels as blood flows through the body. Number two, heart attack, to prevent a heart attack or limit heart damage after an event. Number three, heart failure, to help the heart pump more blood to the body. And number four is a stroke, to open blood vessels, allowing blood clots to move through without causing a stroke. And next is fatty liver disease, to prevent inflammation in the liver. And then kidney disease, to slow down kidney damage, especially related to diabetes. Now we see the mode of action or mechanism of action of angiotensin II receptors blocker or angiotensin receptor blockers ARBs. How do angiotensin receptor blockers work? When your body has too much angiotensin, you start to retain fluids. Excess fluid retention causes your blood pressure to go up, and high blood pressure causes the blood vessels to contract or become narrow. For this constriction to happen, angiotensin II needs another protein called a receptor to bind to. ARBs block these receptors proteins, so the angiotensin cannot bind and constrict the blood vessels. This allows the blood vessels to relax and stay open, and blood then flows freely and without excessive force. Now we see the types of angiotensin receptor blockers. What are the types of angiotensin II receptor blockers ARBs? Medications that end in sartan, SARTAN, are ARBs. They include azilsartan, midoxamil, and brand name is ARB, and candesartan, brand name is Atacant, and aprosartan mesylate, brand name is Tevitan, and ibisartan, brand name is Evapro, and losartan potassium, brand name is Cozar, and olmesartan, brand name is Benicar, and telmisartan, brand name is Micardis, and valsartan, brand name is Diovan, and prixartan. Now we slightly discuss the side effects of angiotensin receptors blockers. Healthcare providers often prescribe ARBs instead of angiotensin converting enzyme (ACE) inhibitors. ARBs cause fewer side effects. Both types of drugs reduce the effects of angiotensin. The main side effect of ARB, angiotensin receptor blocker, is dizziness. In rare instances, ARBs or angiotensin receptor blockers affect blood flow to the kidneys. This problem is more likely to occur if you already have renal artery disease. You will have occasional blood tests to check your kidney function. Now, comparative to angiotensin receptor blockers, ARBs, AC inhibitors have lower angiotensin production. This medicine causes more side effects like chronic cough or dry cough, loss of taste, skin rash, kidney damage, and kidney damage is rare. Now we discuss that is it safe to take angiotensin receptors blockers during pregnancy? No, medicines that lower angiotensin levels such as ARBs and AC inhibitors can cause serious complications during pregnancy. The medication increase the risk of birth defects. Number 2, hyperkalemia, high blood potassium. Number 3, kidney failure. And number 4, low blood pressure. And number 5, stillbirth. If you have high blood pressure before pregnancy or you develop it during pregnancy, preeclampsia, your healthcare provider will prescribe a different medicine that is safe for you and your unborn baby. How do you take angiotensin II receptors blockers or ARBs or angiotensin receptor blockers? ARB are oral medication. You take the medicine once or twice a day by mouth depending on which angiotensin receptor blocker you are taking. So how long angiotensin receptor blockers should be taken? How high blood pressure often returns when you stop taking a medication. You may need ARBs or another blood pressure medicine for life. Now we see the interaction of angiotensin receptor blockers. When we are taking blood pressure medicine, we should always check with our healthcare provider before taking over-the-counter medicines or supplements. Some medicines for allergies, cough and cold, as well as non-steroidal anti-inflammatory drugs, NSAIDs, they can increase the blood pressure. They counteracts the effect of the ARBs, angiotensin receptors blockers. Angiotensin receptor blockers may raise potassium levels, so you should not take potassium supplements or potassium sparing diuretics with them. Potassium sparing diuretics such as eplerenone Inspra increase urination but prevent your body from eliminating excess potassium. Too much potassium can lead to hyperkalemia, high blood potassium. High potassium can cause an irregular heartbeat and other heart problems. So now we see that which food we should avoid when we are taking angiotensin receptor blockers. If you are taking an angiotensin receptor blocker and following a sodium controlled diet, you should avoid salt substitutes that contains potassium chloride. Regularly heavy alcohol use can worsen the high blood pressure, but binge drinking may lower it too much, causing you to faint. If you drink alcohol, aim for minimal to moderate consumption. Now we discuss the one brand of valsartan, that is the Diovan, and Diovan, it is the brand name, and in its angiotensin receptor blocker, valsartan is present. That is, its generic name is valsartan, and drug class is angiotensin receptor blocker. So we see that what is Diovan. Diovan is used in adults and children in 1 year of age and older alone or in combination with other medication to treat high blood pressure. Diovan is also used in adults to treat heart failure, a condition in which the heart is unable to pump enough blood to the rest of the body, and to improve survival after a heart attack. Diovan belongs to a class of medications that called angiotensin II receptor antagonist. Valsartan works by blocking the action of certain natural substances that tighten the blood vessels, allowing the blood to flow more smoothly and the heart to pump more efficiently. Dosing information: usual adult dose for congestive heart failure. Initial dose 40 mg orally twice a day. Maintenance dose 80 to 160 mg twice a day. The dose should be increased to the highest dose tolerated by the patient. Usual adult dose for hypertension: initial dose 80 to 160 mg orally once a day. Maintenance dose 80 to 320 mg orally once a day. Usual adult dose for myocardial infarction: initial dose is 20 mg orally twice a day, and maintenance dose is, the initial dose may be titrated upward within 7 days to 40 mg twice daily, with subsequent titration to a target maintenance dose of 160 mg twice a day as tolerated by the patient. If symptomatic hypotension or renal dysfunction occurs, consideration should be given to a dosage reduction. Valsartan may be initiated as early as 12 hours after a myocardial infarction and may be given with other standard post-myocardial infarction treatment, including thrombolytics, aspirin, beta blockers, and statins. Disclaimer: China's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindication, or drug interaction. So consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please subscribe to my channel Medicine Guide.